Mr. Nelson doesn't know anything about medicine, and therefore he has no idea whatsoever how people function. He has not yet understood our system. I think it's a matter of time. Maybe he understands but does not accept that how it is. When you first have the handle on administration, you have tremendous dreams and goals and ideas, which if you are not careful, you'll get carried away and become frustrated. But after doing it for 7 years, you become pragmatic, and therefore you look at it a little differently. You don't become cynical, but you realize that the goals that you may set yourself are not realistic.
I have had time to lose my cool at the attitude of some of the staff. I said, but you have been here for 20 and odd years, and you have watched this once nice institution go down to it. Didn't you put up a resistance? Didn't you beg, plead, march on the Ministry of Health or the government and say you can't do this to KPH?
Which way, boss? Oh, God.
Dennis Rainsford has burnt his skin trying to unblock his toilet with caustic soda. It's not the kind of case which takes priority here.
Wanna get to which part? Go in that room around here and wash off yourself. Doctor, can you speak to a nurse?
Casualty staff aren't paying Mr. Rainsford much attention, and he's a little confused. The cameraman directs him to the washroom.
What was I don't know?
Let's wash your,
Yeah?
put your head on the tap.
In the water?
Yeah.
Acid is often used as a weapon here, and acid burn victims are commonplace. Washing with water is a standard treatment, but Mr. Rainsford hasn't yet seen a doctor. The best advice he gets comes from two members of the cleaning staff.
He should never wet himself.
Them tell him to come wet himself. Wet
Acid
himself
burn.
and cool him down.
Yeah, man.
Acid burn.
Yeah, you see whenever time acid burn you, and if you could have just get to wipe it off, wipe it. Just
Water and then you put on the middle.
you see from the water touch it, in feel it
get acid burn, yes,
so you put water upon it while it stay like that. If you just...
No, if you never put the water,
That's easy,
you'd
man.
like,
Acid
no.
throw away on my hand, you know. Acid throw away on my hand. And the most thing I could do is grab my rag and wipe it off. And see me hand here, just wipe it off.
I want cast it.
No, what's the problem, see? The toilet wall block. Yeah. And it end up that I do everything to clear it. Yeah. I'm going to go and buy some gas and turn on. Throw a lot of water and try to plunge it. This is something else. I'm going to just stick a matches and it just explode up for me. What? Yes. That is it.
Oh dear.
What must I do again?
You have to come back since I said you have to cool off. Come back and sit down. Jeez, yo. Some things can happen to people.
Jesus.
Mr. Rainsford is in pain, but at the moment, staff are too busy to help. About 40 minutes after arriving in casualty, Mr. Rainsford received some medical attention from Nurse Needham, who'd just come on duty.
Well, right now we can just clean it up with some normal saline, get it cool, and cover it up with some sulfur tool. That's all we do for him now. Nothing else, and some painkiller, some analgesic.
Finally, the patient is seen by a doctor.
You don't feel no pain, right? 4% superficial burn. There's no damage to eye, nose, mouth, or the ear. There's not much loss of tissue there. It's just superficial, mostly. You never go into your nose, oh no. I don't go into your eyes, right? Lucky guy. And it's with caustic soda. Yeah. Lucky that it never went into his eyes, because that can be real painful, cause a lot of damage to the eye.
And I'm beginning to think, do we really care? You make pleas and, nobody hears, or they hear, but there's no action. And you feel very, very incompetent. You're unable to do what you know should be done. I am in this situation now. I know what should be done. I know what should be done. We must treat our sick with more respect.